Hey there, I'm Dr. Teresa Green with Align Chiropractic, and today I wanted to give you a little review on some electrolyte replacement drinks. It's a hot summer day, and when people are outside exercising and sweating profusely, their electrolyte replacement needs might be slightly different than, say, in the winter when you're just sweating a regular amount. So the two brands I like and I personally use, and I'm not paid for my endorsements of them, although never opposed to that, are Ultima and this brand LMNT, and there are some pretty strong differences between these two, but this is the one I typically use year round. So if I'm exercising and I want to replace my electrolytes, I like this one for a couple reasons. One, both of these brands are sweetened with stevia versus some of the other sweeteners, and I prefer stevia to some of those other choices for a variety of reasons. Two, this one tends to have a little more of the magnesium than some of your other brands have, and magnesium is pretty important for muscle function. You know, your electrolytes are calcium, magnesium, sodium, and potassium, and you need to have the appropriate amounts of those for your muscles to relax and be healthy after workouts. So this one has a higher concentration of it, and it is a pretty absorbable form of magnesium. There's a term called bioavailability, and the form that's in this is actually a very good bioavailability, as is the calcium that is in this. So I recommend this one also for my patients who maybe are having muscle cramps at night or leg cramps at night, as a way to see if it's due to an electrolyte imbalance. So this is one I like to use year round. Now, word of caution with magnesium is that you do not want to exceed 400 milligrams of magnesium per day, whether it's with supplements or diet, because it also is a laxative. So use with caution. So this brand I use strictly in the summer months when I am sweating pretty heavily when I ride my bike outside for about an hour. So this one's a little different. If you look at the content on this one, and it shows you right here, it has 1,000 milligrams of sodium. Now, again, word of caution with this. Your daily intake for most people is 1,500 milligrams. That's combined diet, supplements. If you're eating a high processed food diet or you're eating out a lot, your sodium content's probably pretty high. So you might not need this even if you are sweating profusely due to outside exercise or prolonged activities. So the other difference with this one is that if you look at the label here, it actually doesn't have any calcium in it. So this is not a completely balanced electrolyte replacement. It is really high in sodium, which is good when you're sweating profusely. So it also does have magnesium in it, which I like, and potassium, which is the other electrolyte we didn't talk about. But the form of magnesium in this supplement is a little different, but also bioavailable. So just again, differences for your different needs. This one I recommend for my people who are maybe having leg cramps at night as a great way to try to see if electrolyte imbalance is the cause. Also good for my normal daily athletes who are working out 30 minutes a day or so inside, maybe not sweating profusely. This is for my maybe higher intensity athletes, or my pickleball players, or my tennis players who are outside sweating up buckets outside during the summer months. So just something to consider. Hope this helps.